We have a question from a concerned mom, and here it goes. I have had one cesarean section. I want to try a vaginal delivery for my next baby. What do you advise? So you see, so long as robots slash AI has not taken over birthing babies, the question of the mode of delivery would always be a concern. Should a woman go for a cesarean delivery or a vaginal delivery? Remember that no mode is superior to the other. But what would be in favor for you to have a cesarean section and then follow up with a vaginal delivery? This is what I'm going to be answering in this video. So you're going to be looking at it in two prongs. First of all, if you have had one cesarean section, can you have a vaginal delivery? Yes, with some provisos. Number one, what was the reason for the first cesarean section? If it's a reason that is fixed and recurrent, that may inform the decision for your next delivery, and that may require a cesarean section. This is what I'm talking about. For instance, if your pelvis is narrowed, what's referred to as a contracted pelvis, this is not about your hips or your buttocks or anything like that. This is about the bone, your pelvic bone being narrowed and not permitting the baby to pass through that passage. The bone is fixed. That is how it is. And there's nothing that can enlarge the bone, so to speak. So, since the pelvis is narrow, it would continue to hinder successful vaginal delivery. So in that situation, a cesarean section, a repeat cesarean section becomes the mode of delivery. Other factors that may interfere with a successful vaginal delivery include the part of the uterus or the part of your womb that was cut. I took the liberty to sketch two dummy images for you, and you're going to see if the cesarean section you had involved the cut at the upper part of your womb, just like is in this picture. It makes trying for vaginal delivery risky and associated with complications such as rupture of the uterus. But if the cut was made lower down here, like you can see on this image I drew here, then the chances of a rupture, a tear of your uterus is low. So this favors a vaginal delivery after one cesarean section, but this doesn't. What are other factors that can favor a successful vaginal delivery? If your baby is not big, your baby weighs less than 4 kg at the point of birth, if the placenta is located away from the cervix, it is not at the cervix, it is not close to the cervix. In fact, those are reasons why you have a repeat cesarean section, what we call placenta previa. But if your placenta is away from the cervix, that is in favor. If your baby is coming with the head is down in the pelvis, not the buttocks, that is another positive. Also, if labor starts on its own, that is very beautiful because inducing labor when there's a previous cesarean section can be problematic, but when labor starts on its own, that is awesome. That is a positive. That is a sign that a vaginal delivery would likely be successful after one cesarean section. But if you have had two cesarean sections, two cesarean sections. Now, in this part of the world, there are issues with emergency services such as blood transfusion, cesarean section, even having the skilled personnel that can quickly take a woman to theater if there are complications. This is not available in many areas in Nigeria and some other countries. So after two cesarean sections, because the risk of a uterine tear, uterine rupture is higher, we don't want to lose you. We don't want to lose your baby. We cancel for an elective planned cesarean section that is controlled. Blood is ready. The staff, the skilled obstetrician that will carry out that delivery is on ground. So, if you have had one cesarean section and your doctor is telling you you're going to have a second cesarean section, there may be reasons which you have outlined. And remember that this video does not replace discussion with your doctor and one-on-one individualized counseling with your doctor. So your doctor may be right to say that you have your doctor may be right in advising you to have a repeat cesarean section, or a vaginal delivery can also be okay depending on your individual case. So this is just a guide, and it serves as a guide for you to interact with your doctor or midwife. If you like this video and it got value, subscribe, like, share. See you in the next video.